Hi everyone, I'm Dr. Carolina Victoria out of Miami, Florida. I'm an oculofacial plastic surgeon and I have the honor of presenting today an interesting case for you guys to learn from. So I saw this patient back in August of 2021 with what she complained about brow asymmetry after having undergone cataract surgery. And upon closer examination, I realized, that there's definitely some left brow asymmetry. Her right eyebrow seemed to be sitting higher than on her left brow. And if you examine her closer, she actually had an incision on her right brow in the supraciliary area of her brow, consistent with a previous brow surgery. So after having discussed with the patient, we decided this was all due to a history of asymmetric surgery, meaning she had already had a direct brow lift on one side, and then what she was really feeling was heaviness on her brow on her other side. So we went ahead and recommended doing a direct brow lift from her left side to create more symmetry and relieve some of that heaviness on her left brow. And you can see she had pretty symmetrical results. She was really happy with her results. This is back in June 2022, about a little over 6 months since her first presentation. And this gets more interesting, trust me. So she was extremely happy with her symmetry. I see her about 6 months later complaining of heaviness on her eyelid and edema. It was a weird presentation. I didn't quite know what to make of it. Her brow did look a little bit fuller. On her eyelid specifically, the dermatochalasis just seemed to be a little more boggy. And if we go back to her previous picture, we'll see that actually it was a little bit more boggy than it was before the surgery. And so I recommended that she do a metral dose pack. I wasn't sure why she was a little bit swollen, and her symptoms did improve. She did have a little bit of like that extra dermatochalasis on her upper eyelid there on the left upper eyelid, but she seemed to think her symptoms had gotten better. I recommended that she sleep upright to help with some of those symptoms that she was having and prevent further edema. And overall, she did well until I saw her again. And again, here's our original presentation. When we look at the left upper corner, that was her original presentation. And then below it, you'll see that direct brow effect immediately after her surgery. And then you'll see in the top right picture when she presented with the swelling of her eyelid, and then after a mitral dose pack, noticing that there's maybe a relief of edema, but you still see that extra dermatochalasis, which was not noticeable before. She then presented to me a few months later, close to 9 months later, complaining of her eyelid closing. So here we are again, having had undergone a direct brow lift on her left side. She had already undergone a direct brow lift on her right, and now she was complaining of her eyelid closing on her left side. If you notice, there's signs that the patient may be a cosmetic patient, but there was no history of recent Botox in the past. And if you pay close enough attention, we'll zoom into the eyes, you'll notice that she also had a little bit of anisocoria. And whenever you see a patient that has a mild ptosis and potentially anisocoria associated with meiosis on the side of ptosis, obviously the main concern is to rule out a Horner syndrome, right? So if you zoom out of her picture, you'll also notice some mild facial asymmetry, and it's also important to pick this up. So what I did for this patient is I referred her to a neuro-ophthalmologist, and she got worked up for Horner syndrome, and I also got some imaging of her brain, specifically an MRI with contrast to check her CP or cerebellopontine angle. And it came back that both were normal, and this patient was diagnosed with a left hemifacial spasm. Here's her picture about a month or two after her presentation about 6 months ago, and you clearly see now a narrowed palpebral fissure, not just ptosis, but her whole palpebral fissure is narrowed, meaning her left upper eyelid is now droopy or sitting lower, as well as her left lower eyelid is also sitting droopier or higher than the other side. You'll see that the brow musculature may be a little bit have an increased tone on the left brow, and you'll also notice that even her nasolabial folds on her left side are going to be a little more pronounced in this area here, that maybe her left lip is slightly being pulled up a little bit more, all consistent with the left hemifacial spasm. So we should all be aware that, ptosis is very common in our patients, and the aging process does tend to occur in a symmetric fashion. And whenever we see an asymmetry or something that just does not fit the picture, we always have to think outside the box. And not every droopy eyelid is a ptosis. We have to think of other things that could be causing asymmetry in our patients, such as Horner syndrome, which thankfully this patient did not have, or hemifacial spasm, which is more frequent than I think people think. And we know that hemifacial spasm is basically an involuntary muscle contracture, usually involving one half of the face. It usually starts in your periocular area, and then it does tend to gradually involve the ipsilateral facial muscles, which can tend to make the cheek bunch up, maybe that nasolabial fold become more prominent, and make her lip sit up a little bit higher, as well as the mentalis muscle as well. It can be very mild, it can be very severe, and treatment is recommended when these patients are having their activities of daily living being involved. Other patients that will develop these issues can include patients that have had Bell's palsy or injury to their seventh nerve, tumors, or other neurological conditions, which is why I always recommend obtaining an MRI, specifically to make sure there's no tumors that are pressing on the facial nerve causing that hemifacial spasm. Mainstay of treatment or gold standard treatment nowadays is botulinum toxin injections in the areas that are involved. Obviously, of course, discussing with the patient the risks, benefits, and alternatives. As we know, botulinum toxin injections around the eye can actually decrease or blunt their blink reflex, which means they cannot protect their eyes at night or when they're blinking during the day. They can also be treated with muscle relaxants, although this is going to be a systemic effect with minimal effect on the actual facial nerve. There is a macrovascular decompression surgery, which is usually done by neurosurgeons, and facial nerve rhizotomy or selective neurolysis for patients that are not surgical candidates. So I hope that we learned a lot about this patient, and let's hope to always keep a differential diagnosis in our list and not just go to our straightforward answers and think outside the box. Thanks for paying attention. Bye.